today's talk is going to focus on how how the science of teams has the potential to influence and impact beneficially team science. So let me start with just some motivational background by saying that team science meets today's needs. So there are increasingly questions worth answering today are those that are big and complex. And that's particularly true in the realm of clinical research. Sometimes we call them the big hairy problems or grand challenges. These are challenges that may require speed, innovation, flexibility. They may be challenges where the application of traditional approaches may just simply not be sufficient. There could be significant costs of failure, and in these cases, collaborative interdisciplinary efforts are what's needed. With respect to these efforts, however, there is a set of fairly predictable challenges because the work is interdisciplinary. You see a set of different interdisciplinary preferences related to things like language and methods and ways of knowing how to lead and communication barriers that may arise that can create misunderstandings and misinterpretations. There are challenges related to integrating diverse perspectives, to ways of leading, to team dynamics that arise because of these disciplinary differences, and also the need simultaneously to be evaluating and assessing success to learn for next time. So there are many types of teams and teams of many types. I'm starting here with a set of definitions to get us on the same page. So Richard Hackman, who has studied extensively teams, gave us a foundational definition of teams that works pretty well. He says that a team is a bounded and stable group of individuals who are interdependent and seek to achieve a common purpose. So I've highlighted four, important elements of that definition of teams. And maybe the first thing you note, because you work in healthcare, is that not every team is bounded and stable. Hopefully they are interdependent in some sort of way, and they do share some common purpose. But there are all kinds of teams, and we want to acknowledge that. For our purposes, there are teams ranging from project teams to multi-team systems focused on larger goals. A project team is the type many of you may experience on a fairly regular basis. We bring people together. They've got different skills and expertise, different experiences that are needed to work on the project. They work together to develop new ideas of solutions and products that seek to generate change. Those teams are typically time limited to some extent. In the center, we kind of move to more advanced forms of teams, interprofessional teams and interdisciplinary teams. You all, as healthcare professionals, work on interprofessional teams, combining, nurses, physicians, maybe social workers, psychologists, pharmacists, or therapists, etc. The idea of an interprofessional team is you need these different professions to work together, to learn from, to discuss with each other in order to enable effective collaboration in order to improve your patient's health outcomes. There are also interdisciplinary teams, similar to interprofessional teams, but drawing on people coming from different disciplines. And the idea there is that you would integrate the information, data, techniques, tools, perspectives, concepts, and theories from more than one discipline or body of specialized knowledge in order to advance fundamental understanding or to solve problems. So oftentimes you can have interdisciplinary and interprofessional teams, and often in the case of multi-team systems, we do. So here, a definition of multi-team systems are as complex networks of interdependent teams of interprofessionals and interdisciplinary members that have their own proximal goals, but work within and across teams towards some shared superordinate goal. So lots of different types of teams. We also, of course, have kind of teams that are co-located and work together in person, other teams that are entirely remote, and everything in between. So lots of different types of teams, very helpful to first evaluate the kind of team we are when you're thinking about how to apply the science of teams to team science. Um, so we've got, all different kinds of teams, and then we have team science. I want to give a definition of that. This comes from Bennett in a field guide of collaboration in team science that's a few years old now, but still a very popular definition of team science. It's described as a collaborative effort to address a scientific challenge that leverages the strengths and expertise of professionals trained in different fields. I highlighted two key terms here, collaborative and effort. So collaborative, obviously what they're trying to do is draw on the strengths and expertise of the different professions, different disciplines that they bring together to do the work of the initiative, and effort. So effort means that this is an intentional act. And there's recognition that in order to leverage those strengths and expertise, you actually need to focus on making that team work as a team. So that's how I view team science. We also, Mike, in his introduction, described the team science initiative that's ongoing for the school and the Department of Medicine. I hope you're familiar with it. There has been opportunity for people to contribute. I give you the working definition of team science based on that initiative's integration of people's input already. So we're describing team science as an interdisciplinary, inclusive, collaborative effort led by Department of Medicine investigators to address large-scale, high-impact scientific questions across the translational spectrum. So very much drawing on the definitions that we've been talking about already. And then we say team science initiatives will improve human health by using the strengths and expertise of professionals who share a diversity of career stages, fields of research, lived experience, and organizational affiliations. So, things to note here, led by someone within the Department of Medicine, large-scale, high-impact scientific kinds of questions. The idea here is, as we discussed, drawing on different professions and different disciplines, expertise, and experience to impact these large-scale decisions. So that's the hope of the Team Science Initiative in the Department of Medicine. And if you, I think our representatives are Steve Ash and Donna Zillman. So if you want to learn more about that, please reach out to them. I'm going to, as Mike said, I'm going to draw on three initiatives, programs that I'm involved with to try and provide some examples when I start to talk about the science of teams and its application to team science. So three initiatives that I think of as team science initiatives. This one called AI Ready is NIH funded. It's actually one of 4 projects within a program called Bridge to AI. AI Ready is seeking to generate a flagship AI Ready and ethically sourced data set to support future AI-driven discoveries in diabetes. So we are trying to create an equitable multimodal data set through data collection. We're applying ethical and fair principles in order to collect and to share the data. We're developing tools and best practices for helping future data generation projects, and we are involving the community in both the data collection and data use efforts. It involves clinicians, ethicists, computer scientists, data scientists, social sciences of many different stripes. We're trying to collect data on 4,000 people, more than 15 data types being collected. We are working across 8 research institutions. I should say this is an initiative that's being led by UW colleagues. Stanford has 2 different component parts. My Stanford group is leading the effort around trying to apply and advance team science through this initiative. But overall, there are more than 50 plus members. So you'll see the symbol in the upper left-hand side when I talk about the AI Ready initiative. Second example I'll draw from is called IPATH. Our goal here is to improve diabetes care and disparities in the US by developing a scalable, person-centered, team-based, and technology-enabled care delivery model for federally qualified health centers. This initiative includes clinician scientists, mostly primary care and cardiology clinicians, social scientists, again, of various stripes, statisticians and computer scientists. We have the way the project is designed is having 4 study teams. So Stanford, Harvard, Ohio State, and a nonprofit group out of Puerto Rico are all working together. 20 plus team members. We are trying to enable by having these 4 study teams working side by side. The hope is to enable rapid and standardized data collection, including qualitative data collection, and also we'll be comparing traditional and computer-driven qualitative forms of analysis. So having 4 regional study teams is enabling us to do both the qualitative as well as the quantitative data collection and data application work as rapidly as possible. You can see on the right-hand side, this depiction, there are 2 phases of this work. On the left-hand side, we describe a positive deviance study where we're comparing high and low performers, where we're really trying to unearth care innovations for treatment of patients with diabetes. We're using that to inform an intervention that we're applying in a stepwise cluster randomized trial design. But the innovation that we're applying here is that intervention will be customized and modularized based on both organizational and population-based needs assessment that will allow us to tailor the intervention to the cohort of FQHCs that will be participating in that trial. So this is a large R01 funded by the National Institute of Minority Health and Disparities. And then the third example I'm going to be drawing on is funded by the National Science Foundation. We call it the Future of Technology-Assisted Work in Healthcare. Our goal here is to develop and evaluate innovations in hospital-based information and communication technologies, software algorithms, and integration of technologies with workers and workflows. This one is designed a little bit differently. Here we have 4 streams, more than 30 members. We're mostly here at Stanford, although we are collaborating with colleagues at Intermountain and at Johns Hopkins in a couple of these studies. We're designed as 4 streams. So we've got people focused on hardware development. We've got people focused on software development. We've got a big social science research team and an economics and health services research team. And depending on the projects that we're working on, we are collaborating with people from surgery, from critical care, or from gastroenterology. And so the team involves, all of those different types of people. We're working on a very diverse set of projects and data that is drawing from kind of observation, interview, surveys, but also from EHR, the STAR data. We're drawing from the OR black box information that's coming out of surgery and various computer vision technologies. So again, funded by NSF, this is another large R01 type of mechanism. So to focus us again on the purpose of the talk today, I want to make what I hope is a useful, at least it's an important, I think, distinction between team science, the science of teams, and the science of team science. So team science, as we've said, is an interdisciplinary, inclusive, collaborative effort. So with emphasis on the collaborative and the effort part. I put that in that orange bubble down on the right. The science of teams is sort of my field. It's a rigorous evidence-based field of management that comes largely out of the organizational behavior field. We examine how to perform and to lead teamwork. So we'll call that the science of teams. There's also, I want to acknowledge, a burgeoning science of team science. So 15 or 20 years ago, a group decided that sort of a meta science around team science specifically was appropriate. So this is a kind of conceptual and methodological approach that aims at understanding and enhancing the outcomes of specifically of large-scale collaborative research and training programs. So this is kind of that is the science of team science. Because I am a team scientist in the organizational behavior sense of the word. My research for the last large number of years has focused on kind of the science of teams and its application in health delivery, and more recently in team science. So I'm going to talk today about how the science of teams can develop our ability to conduct team science, with all respect to the people who are focused specifically on that meta science of the science of team science. I don't want to take away from their specific role. So today we're talking about science of teams, how it applies to team science, and hopefully we'll all learn together from that. So in a nutshell, here's what the science of teams says about team science. It says that team science teams or team science initiatives are endowed with a set of inputs, things like how complex the system of teams is, the size of the team, how the team is composed, the extent of the diversity of the team, in all kinds of respects: cultural, demographic, geographic, functional, educational, ethical, the different personalities. You've got a set of goals. You've got a variety of contextual factors that are all kind of influencing the inputs to the team science program or initiative. You also then have a large set of mediators or processes that are in large part kind of potential to facilitate or sometimes to undermine the role that inputs have in converting to outputs. So among the mediators or processes that we could be talking about are leadership, coordination, communication, collaboration, and integration within and between teams, various forms of cognition, the extent to which people on the teams share the same mental models, have the same knowledge, have the same understanding of their goals, the distance between the groups and their goals, a whole variety of forms of affect and motivation. So how much goal commitment there is among the group and how much variation there is in that, how much social identification there is, and in what forms. We can talk about cohesion in the group, collective efficacy, mutual trust, psychological safety. So lots of mediators take those inputs and convert them to outputs. And with respect to outputs, or basically we think of it as team effectiveness, there are also a variety of outputs that we look for. Goal achievement, probably first and foremost, but we can also think about learning to be a better team, and to see members of the team also learning and growing. So again, in a nutshell, the science of teams has something to say about kind of all of these things. I'm not going to try to cover it all today, but I'm going to try and go through some of these things. So I'm going to start with inputs. I'm going to talk specifically first about team composition and diversity. First of all, I want to acknowledge, importantly, that especially in team science initiatives, diversity matters. It matters because the work that team science initiatives do is complex, and requires us to have multiple people with diverse specialized qualifications. That diversity is important because those skills and qualifications are suited to perform the complex work that team science teams undertake. They're often requiring breadth and depth of different kinds of skills and expertise. So diversity matters. We need it for team science kinds of initiatives. Diverse teams also bring a wider set of context from which to draw resources. So two pictures on the bottom here. You can see kind of the core team are the ones that are in darker colors and connected by solid lines. On the left-hand side, you've got a team where the core members are more homogeneous. And what it means is that they know the same sort of people. They know that they have the same sort of information. You compare that to the picture on the right-hand side, where the core team members are more diverse, and it means that the set of resources that they draw on, their connections, the information, the expertise is much more different. And so by having that diversity, you can see in this picture, it gives you the opportunity to do what we often need to do in these complex team science projects. So diversity matters, and it also matters that we select the right members of the team to represent that diversity. So we are looking for the right level of diversity. Obviously, more complexity requires different perspectives and more specialized skills, as we've been saying. But you want to give those people, you want to make sure those people have, or you give the right training and background. You also want to make clear their roles, and that the roles are sufficiently differentiated while also being interdependent, so that people can kind of do what their expertise allows them to do. You also want to keep the membership as small as possible. We talk about, big teams and complex projects requiring diversity, but you don't want them any bigger than they have to be, because it's really hard to work together in teams. And it's also therefore important sometimes to consider the interpersonal skills of the people on the team. At least some people should have depth of interpersonal skills in order to allow effective teamwork to happen. So first example I want to draw on is that IPath project that I talked about, with these 4 different teams. We've got 4 interdisciplinary, locally based teams with each of which are specializing in the federally qualified health centers in their states. And doing that enhances our ability to recruit the FQHCs, and it's going to promote our ability to tailor our implementation of the intervention to the FQHCs in different areas. California, the patients all speak Spanish. In Puerto Rico, everybody speaks Spanish. It's not true in Massachusetts or in Ohio. And there are other differences in the kind of patients that we're talking about the FQHCs treating, and the different different backgrounds of the members of the team. So having these 4 interdisciplinary, locally based teams was really, really important for IPath. So that was an example of an input and the value of being thoughtful about how to compose the team and who we have on the team. Next piece I'll talk about are these mediators or processes. And as I went through, there's lots of them. I'm going to focus on 3. I'm going to talk first about social identity, and then I'm going to talk about leadership, and then probably my favorite, psychological safety, hopefully familiar to you too, and many of your favorites as well. But let me start with social identity processes. In the science of teams, we talk about at least 2 forms of social identity: individual identification and team identification. So I'm going to talk about the benefits and challenges of each. First, I want to talk about individual identification, which is really important in teams. We define it as the belief about who I am, what is my expertise, what I bring to this project. I recall from the AI Ready project, one woman, every time she introduced herself, she talked about the way she was an anthropologist and what she was bringing to the group because she was an anthropologist. People's individual identification is typically stronger as the teams are more diverse, because you start to see yourself based on your expertise, because you see yourself as different from the other people on the teams. Strong individual identification can be problematic in teams, though, particularly when people infer that others see them differently than they see themselves. If people didn't see that woman as an anthropologist, it would be difficult for her. When people start to feel others seeing them differently than they see themselves, they experience what we call identity threat. And when you experience identity threat, you seek social validation from other people. You acknowledge my role as the anthropologist on the team, right? And you acknowledge that anthropology is an important aspect of what we're doing here, right? So you seek that social validation. And when it's lacking, it's important that people get that social validation. It's important that people have that individual identification, because when you lack it, people start to hesitate to share their information, and they get defensive about their ideas, and that sort of begins begins to undermine team dynamics. And it's especially important because most of the unique ideas have the greatest potential for benefiting the group. And those are also the ones that are least likely to be social validated. So being cognizant of people's need for individual identification is really important. So that's the first type of social identification. The second type is team identification. And so team identification is different from individual identification. It means how strongly we're identifying with our teams. Usually, the stronger, the better. Team identification generally has positive impact for teams. It's really valuable for resolving threats, resolving conflicts, resolving rivalries, which can all emerge in teams. It is problematic, though, if you've got subgroups, which we often do in team science initiatives. If you've got subgroups that are identifying more with their subgroup than they are with the larger team, you can have group rivalry. And so you want to kind of find ways of enabling people to focus on the larger team goals if you can. So AI Ready, I started talking about the role of the anthropologist. I'm going to use it as an example here more generally. We have, as I said, on that team, a group of clinician scientists. These are people who have collected data, worked on scientific teams for years across multiple research studies. They felt that their identity as scientists were being threatened by the ethicists who wanted to do more innovative work in thinking about how to collect data ethically and what that meant. The clinician scientists regarded kind of the ethical data collection as part of what they did do. And so when that aspect of who they saw themselves as being was threatened, it caused an enormous rift. And there was rivalry between the subgroups, which escalated until we started talking about it and were able to kind of lower that escalation by getting people to acknowledge each other's expertise and the value of each other's expertise, the experience that the clinician scientists had in actually doing the work of collecting the data, and the really important knowledge and innovative, creative thinking that the ethicists were bringing and trying to offer to the group. So, it didn't work out all perfectly, but we saw this social identification processes working in action. So really important to think about social identification as one of the processes that go on. Leadership, obviously, always critically important. I'm going to talk about that next. And I'm going to talk specifically about what I think is one of the most important things that leaders do. And I think I'm not alone in that. But what they do is they shape group culture. And I want to talk about group culture in the context of team science, because group culture is part of what makes collaboration, communication, coordination, integration. Group culture enables all of that to happen. So we define, lots of definitions out there. Ways of thinking about group culture are as the accumulated shared learning of an organization, reflects members' shared beliefs, attitudes, values, and priorities. From culture comes norms and expectations about appropriate behavior. A couple of my favorites, the way we do things around here, from Ed Schein, the pattern of automatic assumptions that are unconsciously held and taken for granted. It's also what you can think of as, what people do here when we're not looking. So that's all group culture. Leaders have a really important role in shaping that. This slide talks about how. So on the right, we talk about it as being a continuous reciprocal process, like a wave washing across the shore. I think this image on the left does a really good job of giving people a sense of how it happens. So leadership creates a set of, waves washing over the shore. There are tailwinds pushing them forward. There are headwinds pushing them backwards. When I say leadership, I distinguish that from people in executive roles, and I attribute that to leaders who could be people in executive roles, but they could be any member of the team or team of teams, taking actions that are shaping that shore. That is the culture, and that changes over time. There's backwash because the culture can be very strong and it takes more actions of leadership, but this is the way leadership culture over time. And here's an example from the NSF project that I was talking about, and specifically the work that we're doing with gastroenterology around improving colonoscopy using a computer vision technology. There, the clinician leader is seeking to transition from a performance-oriented to a learning-oriented culture. And he's, his waves, what his waves are instituting comparative outcomes reporting. Next wave, doing individual goal setting with people. You come to me, we talk about your report, you tell me what you're going to do to improve. Next wave is sort of the content of the retreat that they, an all-day retreat that they had together where they really talked about how to use these things. Next wave is rewards. We're going to start rewarding people for these outcome measures. So wave after wave after wave is shaping the culture toward a learning-oriented one. So leaders have a really important role in team science projects. The last mediator I'm going to talk about is psychological safety. Hopefully you all know about it. For those who don't have a definition at hand, we think of it as the belief that the environment or the group or team of teams in a team science project is safe for interpersonal risk-taking. People feel able to speak up when it's needed about ideas, questions, concerns. They're not being shut down in gratuitous ways. In fact, their ideas are being given ample thought. It's present when colleagues trust and respect each other, feel able and even obligated to be candid. So psychological safety supports organizational learning. It improves performance. It's also impacted by the team and organizational characteristics that were those inputs on the left-hand side of the model that I initially showed. Psychological safety is associated with, I think of like all good things. I stopped collecting data a while ago because my slide filled up, but it's, associated with teamwork. It's associated with technology implementation of new practices, timeliness of care, people's emotional exhaustion, so lower exhaustion, lower burnout, people feeling heard, also with outcomes like morbidity and mortality. So psychological safety is associated with all of these things. It's also, and I think importantly for team science, it's associated with breakthrough performance when teams are diverse. Teams are diverse when you have complex problems like team science problems. So I want to focus you on first on the dots. On the left-hand side are a set of projects that have teams that are homogeneous. On the right-hand side, you have teams that are more diverse. On the left-hand side, and then notice the line. So on average, what this is saying is that homogeneous teams typically perform better on average. It's easier to communicate and coordinate when the teams are homogeneous. But there's much more variability on the right-hand side where there's team diversity. And when you need that breakthrough performance, dealing with these complex problems, you need that diversity. But what this slide is saying is that it's harder to on average achieve that breakthrough performance. And what the literature shows is that psychological safety is associated with those teams achieving high performance when the teams are diverse, because it enables teams to overcome the challenges of diversity, enabling people to bring those ideas and enable them to work together. So how do you do it? I'm going to combine leadership and psychological safety by talking about what leaders can do. You can frame the work, you can invite engagement, and you can respond productively. So you can frame the work by framing it as novel. And here you see, our projects all over the place, everybody doing some of these things. So you can frame the work as novel. Our AI Ready team saying, we've never done this before. This is like, creating this kind of data set and this kind of scientific team, really new. Or you can say, I appreciate when someone points out my errors because it means my patients are going to be safer. So we saw that in our surgery group. You can invite engagement. You can share your own mistakes, or you can ask good questions and insist on dissent. So say when you don't know something. It enables people to, to help you. Provide examples of past mistakes and how you learn from them. Ask, what are we missing here? What leads you to think that? And then with responding productively, thankfully, we see that across all of our teams, being appreciative, being humane, and being forward-looking, saying things like, Thank you for bringing this up. What do you think we should do about it? All of these things promote psychological safety. And then when you think about the leader attributes that support psychological safety, I always think this slide is really helpful because, you can look at yourself and say, do I have humility? Do I have sufficient humility? Am I curious enough? And am I exhibiting enough empathy? And to think about the ways these things combine, humility and empathy. Ask yourself, how strongly do I desire to understand and learn? Am I really exhibiting that? The combination of empathy and curiosity, ask yourself, how inclined am I to listen? And humility and curiosity, ask yourself, how able am I to acknowledge gaps? If you can say yes to all of those things, you're typically creating a psychologically safe environment. And again, I want to emphasize, it's not just the leaders with the executive roles, it's leaders at all levels within a team. So lastly, I wanted to talk about the outputs, and I'm going to talk within team effectiveness. I'm going to highlight everybody is interested in goal achievement. I'm going to focus on the second and third goals, the team learning goal and the team member learning and growth goal, because we don't often think about that. First, to sort of express why we're drawn to teams, it's sort of evident in team science teams because we need the resources that the individuals bring, the greater diversity of the resources that people bring. We also like teams because they're more flexible in deploying resources, there are opportunities for collective learning, potential for synergies. But it's important to note that most teams underperform compared to collections of individuals working independently. The whole is more often less than the sum of the parts than the other way around because of these challenges of working together in these large, complex teams. Important to keep in mind what we think of with respect to effective teams. What is it that we're talking about? So Richard Heckman, again, the person who's studied team for, decades, gives us a definition of effective teams. Yes, we should be focusing on goal achievement. We should be producing the output that's useful and valued by the team's client, whoever that client may be. But we should also be thinking about teams becoming increasingly more competent as teams over time. And third goal, fostering team members' personal learning and growth. These things are critically important because they enhance the output of the team. So one last example from the AI Ready group, the working definition of team effectiveness were comprised by these first three bullets. So here it was a collaborative team effort to create a large, high quality, ethically sourced and inclusive data set to enable the use of AI to understand how people, with diverse racial and ethnic demographics develop and progress in diabetes severity and hopefully to apply salutogenesis to turn that around by leveraging the strengths and expertise across modules, stakeholders, and communities. So there was acknowledgement that we were going to need to leverage the strengths and expertise across modules, stakeholders, and communities. But it took us talking about, and we're going to do that by getting better at collaborating over time. And we're going to need to work on that in order to get better over time. And that by doing so, we're going to improve the strengths and expertise of team members. And that's going to enable us to accomplish all the rest of these things. So we can think of this as sort of a closed loop system, but the important need to keep in mind the second and third goals as we progress in order to achieve the first. So I'm just going to recap. You saw this image at the beginning. We've talked about, the way that team science teams and initiatives are endowed with a starting set of inputs. The science of teams talks about all of these different inputs. We talked about the way teams bring these mediators or these processes to these inputs in order to create the outputs that we're looking for, and the importance of not just focusing on goal achievement, but focusing on all three goals in order to create that closed loop system that is enabling these mediators to take these inputs and to achieve the goals that team science teams are trying to achieve. So I'm just going to leave you with this thought that I hope I've persuaded you at least to some extent, that the science of teams can enhance your team science initiative. So I encourage you to learn more, to embrace collaborative approaches in your own endeavors to address complex challenges, and to work with professionals who specialize in the science of teams to enable your success, particularly if you're applying for a team science-oriented project. And I'll leave you with this one last quote that our AI Ready teaming group is very, very proud of. When we did an evaluation of our most recent workshop, one of the computer scientists left us with this comment: I used to think, what is team science? Now I love team science. So having team scientists on your team has the potential for really turning everybody into people who love team science, and that would be our goal. So thank you. I will also say thank you to a large group of team members who enabled this presentation to happen, and obviously all of the projects that I drew on to make this project happen. I give you my email address. I hope she doesn't mind, I give you Colleen Cuddy's email address. She helped extensively with this presentation, but she's also a great resource, a librarian at Lane Library, who is kind of I think of as a card-carrying team scientist. So I will leave you with those emails and encourage you to reach out if we can be helpful. So thanks very much. I look forward to your questions.
Thanks very much, Sarah. I see another card-carrying team scientist on the line, and that would be PJ Utz, who's the director of the team science program in the Department of Medicine. And he will, I'm sure, be happy to help out with the Q&A. And I wonder, before I pass it off to PJ, if I can ask you a quick question regarding team science, Sarah. One of the challenges we face in applying for grant applications is rapid formation of teams. Your presentation highlights all of the thought that could and should be put into composing a team. These days, we very often have to throw a team together quite rapidly and get people working together. And frequently that means it results in a collection of individuals working individually and contributing whatever it is they're contributing by essentially throwing it over the wall. Is there literature and thought around, say, best practices for rapid formation of teams, getting them to work together as a team rapidly? And by rapid, I'm talking on the order of weeks and not months to years.
Yeah,
Thank
yeah.
you for taking that.
That's a great question, and thank you for asking it. What I will say about Stanford, one of the things that I truly love about Stanford, and Stanford medicine as a whole is exemplary of this, is that people are so willing to collaborate. You may not know each other, and you're willing to step up and say, yeah, I can see myself in this project making a contribution, and I'm going to trust that the group is going to be able to work together. It's such a wonderful thing, the way that people at Stanford come together to collaborate and just put themselves out there as willing to collaborate. And there is literature about rapidly trying to do this. Deb Meyerson, who was at the business school at Stanford and the School of Education, she wrote about swift trust, for example, which is ways of rapidly coming together when you need to as a team to build trust very, very quickly, like within minutes and hours, in order to be able to work together, for example, on emergency types of teams. I'm starting a new PO1 that's being led out of Harvard, that's studying care integration in cancer. And one of the things that we're doing, we just received the award. We're taking everybody to a retreat center in New Hampshire, and we're spending 2 days to talk about the project and to meet each other. There is nothing like ensuring the upfront face-to-face getting to know each other, ensuring that people know and recognize each other's expertise in general, and then the expertise that that we are hoping that they bring to bear on the specific project and how it might work together, and then actually sort of exercising the working together. Actually putting the grant together is a great exercise in helping to build the team itself. So making sure that everybody has a role and is working together to do it. And if it doesn't happen that way, bringing them together sometime maybe before the project gets launched, or especially after, you hear that it might have the opportunity to be launched, bringing people together to meet, to know each other, and to learn to work together is critical. And then not stopping there. As we saying, like a lot of these things we do in the AI Ready project, for example, we do workshops every quarter, where we talk about how our teamwork is doing. We also do a survey every year where we're studying team dynamics, and we're giving ourselves feedback about how we're doing within our small teams, within the project teams, and then across that whole 4-project bridge program. And we can see change over time, and we can see, how our small teams are doing better than the project as a whole, but the project is doing much better than the 4-project program. And, we can begin to talk about what we need to do about it. So applying team science as you go forward in those project teams, I think, is really important.
Awesome. Thank you, Sarah. We will open the floor. Feel free to jump in and ask a question, put it in the chat, put it in the Q&A, whatever works for you.
And maybe while we're waiting, Sarah, I apologize for being late. I had to get a family member to an elective procedure this morning, so that's all done. One of the things that we struggle a little bit with in team science right now is how to engage junior faculty or faculty who may have largely clinical responsibilities. What sort of advice could you give us about engaging people who are currently not involved in team science, but may very well want to get involved? And I'll just say one of the things that we're trying to do is Mike and Jack are working pretty hard on the CAP profiles, how to get into those and try to find collaborators. And there's some really cool things being built there. What advice would you give? Yeah,
it's a great question and a hard one, because you sort of want to start out on baby projects before you get to the big ones. But being involved in a large project where you do have more experienced investigators is actually a great place for a junior investigator to learn how to do that kind of large scale research. And so it can be very good for them. In fact, I went on a walk yesterday with a colleague who is on our iPath project, who was saying, I'm not a junior faculty who wasn't sure that they were contributing, or that they could contribute to that project in a way that would be sufficiently beneficial. And, I was able to provide reassurance about, you're a clinician, and I greatly value and appreciate the expertise that you bring. You can, and I sort of recounted for this person what I thought that expertise was, largely in like translating what I'm hearing from clinicians in an interview about, how they're caring, what is and what isn't innovative about care for diabetes, for example, and that translation is critically important, for example. And what I was able to do, because we were talking about kind of the need to be in the clinic a lot and how much time they were going to be able to devote to the project. And what I was able to say is that, I can call on your expertise when we need that expertise, and that expertise is still going to be incredibly valuable to the group. And I can work with them to sort of shore up their understanding of the whole when they need it. If they can't participate in all the meetings, I'm also able to buy out some time for this person so that they can spend more time contributing. And I think that's kind of on the leadership team, and to make sure that that's feasible for people, because having the time to actually engage is the way they're going to learn the most. But I also think that the reassurance piece is critically important, making sure that they don't have to be responsible for the whole, and that what they do have to offer is critically valuable to the work.
Great, thanks. We have four questions in about 7 or 8 minutes, I guess. So
okay,
is the project defined by the team or the leader having an idea and forming the team?
One more time.
Is the project defined by the team or the leader having an idea and then forming the team?
Oh, that's interesting. So it could happen either way, right? Lots of great ideas bubble up, and others, and others come from a leader. Often they come from the funding agency, right? So the funder will give you um, a funding announcement, and you need to work within the constraint of the funding announcement. I love that because you can begin to have an idea, or you can begin to know who might be the people who could contribute to the formation of an idea. And then you can kind of collaborate in order to make the idea sort of really, really sing. I think I find that uh, building an idea in collaboration with the people who you think might work well together is an ideal way to form a team, but it can happen in all different from all different directions. If it is a top-down idea, the leader is going to be responsible for really, really selling it, like picking the people whose roles are critically important and explaining to them why they're playing, like what role it is they have been selected for and why that role is important to the team. And then, selling the idea to them and making sure that they are kind of on board.
Okay, great, thanks. Next is, how do you encourage people to bond and trust beyond expertise? Most humans like to have some fun beyond intellectual fun.
Yeah, okay, so that's a super important point, and I should have spoken about it when I was talking, in my presentation, because the way to build the way to build mutual respect is through both helping people see and appreciate each other's expertise, and now allowing for social connection, because the social connection just reinforces the value that people associate with people's expertise and background. It's a positive reinforcing cycle. That's why when I was describing this PO1 that we're launching, we're bringing everybody together in New Hampshire to have a great, it's a beautiful place. We're going to have an amazing, great time together and create some bonds that will, we hope, sort of linger throughout, the 5-year duration of that program project. So absolutely finding ways of having fun together. In the last AI Ready workshop that we did, which was in Washington, D.C., we brought people together and let them bowl, gave them great food, in addition to talking about, we're at the midpoint of this project, now we got to get serious, how do we need to change as we shift to finishing things off. So you need, the combination of the two works ideally.
Great, thanks. We have 3 more questions, 3 or 4. What recommendations would you have about engaging patients or community members, i.e. people who may not have a science background?
Yeah, so just do it. And I would say, I can't say enough how engaging patients and community members can change what you do. I was leading a large patient safety learning lab sort of before and since coming to Stanford that focused on kind of trying to engineer patient safety processes to make them safer. But we invited several patients, but one in particular who was the parent of a child with the kinds of conditions that we were interested in focusing on designing processes around. And she led the work of the team because she was able to tell us what mattered, what was important, what patients and families, how they responded to the kind of the work. And so as we looked at the kind of process from beginning to end, she was able to tell us kind of where to focus and what to work on. It was completely transformational and totally unexpected. And like bringing her on was the best thing that we could have done for that project. So I would say, just do it and trust the process. So bring to them, they can opine about everything that you're doing, but they can opine upon anything that is patient facing. And given that what is patient facing is often really important to the process, they can help. if you're trying to like recruit patients into a program, into a trial, they can give you suggestions about how to do that in a way that is respectful of a patient, and it's going to help you with that recruiting immensely. So I just say, just do it and trust their contribution. Work to find people who are interested in engaging, but respect and value their contribution, and just do it.
We have time for probably one more question. There's 3 here, so I'm going to combine 2 of them.
Okay.
So Hannah has asked a question about what happens if you may be treading on another colleague's territory, and Mildred Cho asked a similar question in some ways. How should teams deal with disagreement and power dynamics? So the overall theme here is conflict within a team.
Yeah. So the shortest way I can describe it is keep people focused on that superordinate goal. You're there because you have different, you have complementary expertise, so you're going to have overlap. And so talking about the value of the different expertise you have, and the value of the integration of that expertise to achieve that superordinate goal is, I think, the best way that you can do it. And keep openly talking about that, and then how the work is actually going to get done. We did some exercises with Mildred, and I'm happy to talk with you about that, unpacked how we went about resolving some of the conflict that arose, because, if you do a deep dive into looking at how people are talking to each other and different ways, and potentially more respectful ways of talking to each other, you can usually overcome the conflict. So I'll leave you at that, but I would say achieving the benefits of the interdisciplinary and interprofessional collaboration is so worth the effort to focus on the extra effort that it does in fact take to make that collaboration effective.
Great, thank you. So we're at the hour. There is one more question about health equity and team science. So let me just ask Errol, should we have her answer this question, or do you want to end it right on the hour? If Errol is still there.
I think it's Rochelle who's there.
Okay.
I'm sorry, but Errol's not here today.
Okay.
So we can end it. Thank you.
Great. Thanks very much, Sara, for a fabulous presentation.
Thank you, Sara.
Thank you very much. If the person who had the question wants to email, I'm happy to respond.
Great.
Thank you.
Thanks, everybody.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.